welcome back to my channel. It's your favorite doctor. It's Dr. Radilampo, aka Dr. Motivation. And today we're going to be talking about miscarriages. And those of you who are joining us for the first time, you are more than welcome. I'd like to encourage you to please watch our previous videos because everything is a build-up and you need to understand the basic anatomy in order for you to understand miscarriages. So today we're going to be talking about miscarriages, which is one of the questions that you guys asked us on Instagram. And remember, we give the people what they want. What the people want to hear is what we give the people. So today we're going to be talking about miscarriages. Miscarriages happen in 50% of women. So that means that every second woman will experience a miscarriage. That's a lot of people. That is a lot of people. A lot of us sometimes even have miscarriages and we don't realize that we're miscarrying at the time. So I'm going to go through with you guys the different types of miscarriages, the causes of miscarriages, and then the management of miscarriages. What is it that we actually do after we find out that you've had a miscarriage? So the risk factors for miscarriage are maternal age. So the older that you get, the higher your chances are of having a miscarriage. That's why when you are above the age of 35, we call that advanced maternal age. We call you a high-risk pregnancy because when you're 35 and above, everything associated with the pregnancy becomes high risk. You're at an increased risk of having a miscarriage. Another risk factor for miscarriages is having a miscarriage itself. The more miscarriages you have, the higher the chances of you having another miscarriage. So if you have a miscarriage now, your chances increase. You have another one, your chances increase and increase and increase. The third thing is smoking and alcohol, guys. Smoking and alcohol, gumnandi, but let's not do it in pregnancy. In the first trimester, a lot of us usually don't even know that we're pregnant, and smoking and alcohol during that period can put you at risk of developing a miscarriage. So what are the different causes of miscarriages? So we usually divide miscarriages into first trimester and then late miscarriages. Your first trimester miscarriages are the ones that happen before 13 weeks. Your second trimester and third trimester are the ones that happen after 13 weeks. So the causes for the different types of miscarriages are usually different. So I'm just going to go through all of the causes for miscarriage put together. So if you can imagine, forming a baby is basically a sperm and an egg coming together. It's two people's whole DNAs coming together. And it needs to sort of mix in the perfect way to form a perfect human being with 46 chromosomes, so it can be a little bit tricky, putting that together. So mistakes can happen. So if you have any abnormalities in the coming together of the egg and the sperm, the chromosomes forming to form this person, you can develop a miscarriage. So chromosomal abnormalities. So that's sort of your body protecting itself. It gets rid of this abnormal fetus. Because the chromosomes are not normal, your body gets rid of it and you have a miscarriage. The second thing is environmental things like toxins that are in the air. Oh, excuse me, those of you who live in highly industrious areas or you work with harmful substances, that can also induce a miscarriage. The next thing is your medical conditions. Things like hypertension, severe uncontrolled hypertension, diabetes, severe uncontrolled diabetes, thyroid disease, severe uncontrolled thyroid disease, antiphospholipid syndrome. All those medical conditions can cause you to have a miscarriage. We also need to look at infections, sexually transmitted infections and infections. Very dangerous, can also cause miscarriages. We look at things like cytomegalovirus, your syphilis infections, your chlamydia infections. That's why it's very important that if you discover any type of imbalance in your period, in your vaginal discharge, pain during having sex, all those kind of things are signs that can lead you to infection. So you must make sure that you're getting yourself checked out if you have any of those signs. So infections also a very big cause of miscarriage. One big infection that we see a lot in pregnancy is a urinary tract infection, and very common in pregnancy, and those can also cause miscarriages. So ladies, if you need to pee, please go pee. Don't hold your pee in. Please drink lots of water and please drink lots of cranberry juice. If you feel a burning sensation when you pee, don't wait for the last minute. Just get it sorted out as soon as possible. And then there are also uterine factors as well as placental factors that can lead you towards a miscarriage. So remember our beautiful uterus, this is where our baby is supposed to grow. So if you have any abnormality of the actual uterus, so if you have a septum in the uterus, or you have fibroids, which are tumors inside your uterus, or you have adhesions like this, adhesions within your uterus, those are the kind of things that do not allow you to fall, that allow you to push you into miscarriage, sorry. Another thing is placental factors. So when your baby grows, your baby has this thing that we call the placenta, which is the afterbirth. That placenta is responsible for giving your baby nutrients and taking away toxins from your baby. So if there's any problem with your baby's placenta, the placenta doesn't grow well, it doesn't attach to the uterus well, it won't be able to give your baby the nutrients that your baby needs, and then you will eventually have a baby that's not growing, and then you will have a miscarriage. So those are the causes of miscarriages. So let's quickly go through the different types of miscarriage. So the first type of miscarriage is called a missed miscarriage. A missed miscarriage is where we do a sonar and we find that your baby is dead inside the womb, but you didn't have any symptoms at all. The womb is closed, basically. You're not contracting. That is a missed miscarriage. So baby is inside and we find the baby dead and there's nothing we can do. So the next step in a missed miscarriage is that we will probably give you tablets, put tablets inside your vagina or inside your mouth in order to allow the mouth of the womb, which is here, to open up so that you can have a miscarriage. So we basically induce the miscarriage because the baby is dead and you obviously can't stay with a dead baby within your womb. So we give you tablets and then you contract and then the baby comes out. Okay, that's a missed miscarriage. The second type of miscarriage is an incomplete miscarriage. That's when you come to the hospital and you say, oh my gosh, doctor, my water broke, or oh my gosh, doctor, I'm bleeding. And what the doctor will do is they'll do a PV. So they'll put their fingers inside your vagina and they'll find that the mouth of the womb is open and you've lost some of the products. But when we do a scan, we see that there's still something left inside. That's an incomplete miscarriage. So what we have to do in that case is we need to remove the products that are left on the inside so that you make sure that your uterus is nice and clean. The third type of miscarriage is called an inevitable miscarriage. An inevitable miscarriage is where you come, you say, oh my gosh, doctor, I've been bleeding. We check the mouth of the womb and the mouth of the womb is open, but we can still see the baby inside. So even if your baby is inside and alive, if the mouth of the womb is already open, there's nothing we can do about it. It's an inevitable miscarriage. You're going to miscarry no matter what. So that baby will end up passing through. So what we can do is we can give you syntocinon, which will help to contract your uterus to make the process go a little bit faster so that you can expel the baby. We also give you adequate analgesia just to make sure that the process is not too traumatic for you. We also have something called a threatened miscarriage, which is probably the best kind of miscarriage that you can have, because that means that your baby is still alive. It's just threatening to miscarry, but it's not miscarrying. So when we do a PV, we find that the mouth of the womb is still closed, but there's blood on the glove. When we do a sonar, your baby is still alive. So that's a threatened miscarriage, and how we manage that is we give you bed rest. There's nothing that we can do. We look for infections. If there's infections, we treat the infections, but there's nothing that we can do to prevent a threatened miscarriage from becoming a incomplete or inevitable miscarriage. All we do is we give you bed rest. Guys, one very important thing that I forgot, stress. Stress is a very big factor in causing miscarriages. Very, very important to remember. Peace, 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 ladies and gentlemen, peace. Okay? The next form of miscarriage is a complete miscarriage. A complete miscarriage is essentially where you come, you say, yo doctor, I've been bleeding, I bled lots of blood with clots, please check me, is my baby fine? And then we do a PV, we check the mouth of the womb is completely closed, we do a sonar, we look inside the womb and we don't find any baby, we find a nice thin line of your endometrium. That means that you passed all the products of conception, your baby, the placenta, everything is gone, and that is a complete miscarriage. There's nothing for us to do there except to talk about contraception and what we're going to do moving forward for you and your ability to fall pregnant. So how do we manage people with miscarriages? As I just went through, the different types of miscarriages have different types of management. But overall, what we need to do is we need to make sure that your womb is clean, and that will depend on how many weeks pregnant you are. So if you are less than 14 weeks pregnant, you get a manual vacuum aspiration. If you're more than 14 weeks pregnant, you get an evacuation in theater. So a manual vacuum aspiration is something that we do in the side room. We give you some analgesia. We put your legs up in lithotomy position. We put a speculum. We look at the mouth of the womb, which is this part over here. We put a speculum, we look at that, and then we insert an instrument called a vacuum, and we suction everything that's left inside, right? Because now you've delivered some of the products, but there's still stuff left inside. So what do we need to do? We need to clean it. So this vacuum is literally a vacuum. That's what it does. It sucks out everything that's left inside. So we get the vacuum, we clean until we feel this nice, hard, gritty feeling, and then you clean, and then we're sorted and you're done. If you're more than 14 weeks, it's dangerous for us to use a vacuum because we might not be able to get all of the products out. So in that case, we take you to theater and we do an evacuation of the uterus. The anesthetist will put you to sleep. We put you in a lithotomy position. We get a speculum. We look at the cervix and we go in with a curette and we clean. The problem with having multiple miscarriages and having EVACs and MVAs is that it can cause adhesions. Adhesions is basically fibrosis inside the uterus. And if you have lots of adhesions in your uterus or fibrosis inside your uterus, it will be difficult for you to fall pregnant subsequently, because then where's the baby going to grow if there's adhesions everywhere? It becomes very difficult and very tricky. So it's important for you to try your best to report early if you're having signs and symptoms of miscarriage. Do not do unsafe terminations of pregnancies. It will get you into trouble. You can even die. You can become septic. So that's miscarriages in a nutshell, ladies and gentlemen. I hope you guys learned something amazing here today. I want to encourage you to tag a sister, tag a friend, tag an auntie, tag a cousin, tag a sister-in-law, tag a grandma. I want to let you all know that you should like, comment, subscribe, join notification gang. Yeah, guys, thank you so much for watching. I hope this was informative for you. Please comment below. Let me know what you want me to talk about. Have you guys experienced a miscarriage before? What was your experience of the miscarriage? How were you treated in the hospital that you went to? I always love hearing from you guys. It always is a pleasure to serve you guys. And of course, what topics you want me to cover in the future. Ladies and gentlemen, it's always a pleasure. It's your favorite doctor. It's Dr. Motivation. Thanks for watching.